Namaste friends, this is Ramneek in front of you. Today friends, I'll be talking to you about Kapalbhati, which is my second pranayama in my set of mind, body, soul pranayamas. Kapalbhati is a great pranayama and it is very helpful in the treatment of several diseases such as cancer, obesity, tumors, diabetes, liver disorders, skin disorders, and many others. Kapalbhati is done in 3 stages. The most important thing while doing Kapalbhati you got to remember is that the exhalations are done with a lot of force and the inhalations are passive in this pranayama. So you got to remember the force applied while exhalation should be great. I'll show you all the 3 stages of this pranayama Kapalbhati. First thing is you got to close your eyes and keep your one hand over your abdomen like this. Now take a deep breath in. Now you got to exhale with a lot of force, and remember in the first stage of Kapalbhati, the gap between 2 exhalations should be 1 second. You can compare this pranayama to a speed of a train which is just leaving the platform. It goes something like this. Chuk, chuk, chuk. Meaning thereby the gap between 2 forceful exhalations should be about 1 second. I'll demonstrate to you this pranayama. So you see, in the first stage of this pranayama, the gap between 2 forceful exhalations is about 1 second. The thing to be remembered is that if you keep your one hand over your, just close to your nose, and when you exhale with a lot of force, the pressure should be felt on the palm of your hand. If you can feel the pressure on your palms, you're doing it correctly. And if you're not feeling the pressure, you're doing it incorrectly. So remember to keep your palm about 6 inches away from your nostrils as you do this pranayama. You exhale with a lot of force and you feel the pressure of air in your palms like this. Now the second stage of Kapalbhati pranayama is that you exhale at a much greater speed. Now in this stage, the gap between 2 forceful exhalations is about half a second. So you can compare this now again with the speed of a train which is running at its normal speed. It would be something like this now. The gap is half a second in the second stage of this pranayama. The third stage of this pranayama, Kapalbhati, can be compared to the speed of a train which is running at its top speed, meaning thereby there is no gap between 2 successive exhalations. Would be something like this, friends. So these are the 3 stages of this pranayama Kapalbhati. Remember to take into account 2 important things while you're doing this pranayama. First, that as you're doing this pranayama, you only concentrate on forceful exhalations. The inhalations are passive and the exhalations are active and they are forceful. So you got to exhale with a lot of force. And second, you got to remember that each time you exhale, your abdomen goes in. And inhalation is passive, so the abdomen comes back to its normal position. Remember friends, safety precautions while doing this pranayama are that heart patients and high blood pressure patients should not be doing this pranayama. Pregnant ladies should not be doing this pranayama. And people with any abdominal surgeries in the last 6 months should not be doing this pranayama. This is a great pranayama for beating cancer, tumors, constipation, indigestion, diabetes, liver disorders, kidney disorders, skin disorders, and many other diseases. For more inquiries, you can contact me personally at my cell number, friends, which is +91 99101 78140. My website is www.ramneekwig.com. Thank you, friends. Namaste.